operation hobby farmer that has sick cattle exhibiting the symptoms associated with a high-path avian influenza, including decreased herd level milk production, decrease in feed consumption, lethargy, dehydration, or fever, should be reported to the state veterinarian immediately. You can call her at 860-713-2505 or email at ctstate.vet@ct.gov, ctstate.vet@ct.gov. We also want to assure consumers that based on the information research available, there's no concern about the safety of the commercial milk supply or that this poses a risk for consumer health. Dairy farms follow strict protocols to ensure that only milk from healthy animals enter the food supply for human consumption. Importantly, all milk entering interstate commerce must be pasteurized, which is a kill step that removes bacteria and viruses or kills the bacteria and viruses in order to move from state to state. So the commercial milk supply is safe. I'll turn it over to my colleague at the Department of Public Health for some comments and then open it up for questions or clarifications. Thank you all.
Thank you very much, Commissioner Hobart, and to everyone for joining us today. The reason we're gathered here today to discuss this topic of highly pathogenic avian influenza, or what some people call bird flu, is because yesterday, specifically, it was released by the state of Texas and the CDC that there was a confirmed human case of H5N1, which is a type of bird flu. And the person who has this infection had what some people call pink eye or conjunctivitis, and it is a specimen from that particular person that tested positive. The person is recovering and doing better, is taking oseltamivir, or what is also known as Tamiflu, and is recovering. But when we have incidents of a human case, this is when, from a population health and human health perspective, we want to be very vigilant. We know that highly pathogenic avian influenza has been in various different poultry populations, avian populations throughout the country at various different times. But in this situation, it has now been detected in cows, which is a little bit different than what we've seen in the past. And we also know that the person who was infected had close contact with milking of the cow or potentially in a maternity type ward where cows were present. So this gives us a little bit of a sense of where there may have been transmission occurring, but this is an evolving situation and we're learning more information each day. But it is that contact directly with the cow population that seems to have resulted in a human case. So what we want people in Connecticut to know, as Commissioner Hurlburt has said, is that we have not identified any of the highly pathogenic avian influenza cases in the animal population. And certainly there's been no indication at all in terms of potentially animal or human cases in Connecticut. So the risk to people in Connecticut is extremely low. However, if you have regular contact with animals, and particularly ones that may be demonstrating any sort of symptoms, as Commissioner Hurlburt identified, decreased milk production among cows, or the like, any sort of sickness in animals, we want to be highly, highly vigilant right now and monitor your contact and connection with that animal because, again, this is an evolving situation. We want to try to reduce risk as much as possible. Again, there's been no indication of human to human transmission at this time. Again, a situation we're monitoring closely and will continue to do so going forward. So I will turn it back to Chris Boyle from the Department of Public Health, and we're happy to take questions.
So do we have any questions there? Please raise your hand on Microsoft Teams, and we will line you up if we have some folks with some questions. So things are pretty quiet there. So I don't know if, just to call on any of the TV stations. I also see Brianna. Do you have anything before we sign off?
Sure, I'll say something. Hi, everyone. Thanks so much for taking the time. This is Brianna, Wall Street Journal. Really appreciate you doing this briefing. I guess the question that I have is sort of how worried is sort of public health and you about sort of like you said, there's no human to human transmission, but like how alert are you for the risk of potentially sort of human to human and a bigger outbreak, just considering sort of how we've seen this particular strain spread through mammals?
Yes, thank you for that question. So I think in public health, we have had highly pathogenic avian influenza high on our radar as a pathogen that can be risky to humans and certainly have high morbidity and mortality. And so one of the great things about our public health infrastructure and all the investments that have been made, particularly in the area of influenza, because we've known that this is potentially an area where if there was transmission to humans, we'd need to really be on it right away, is that this case was identified with very active surveillance right up front. And as I said, it's an evolving situation. We've always been prepared in public health that there may be a situation where we have more human cases and that potentially that could result in human to human transmission. I don't have indications at this time that that is the case or that we need to be particularly worried about that. But in public health, our job is to be vigilant. Our job is to be aware that that transition could occur, and what would we need to do and have in place if that type of situation did occur, where we had a respiratory pathogen that actually could be transmitted from one person to another, as we know with many other respiratory pathogens that we have. So I think the thing that is reassuring to me and in our public health response, as I was learning about this, Commissioner Hurlburt and I talked, that was my first outreach because we wanted to make sure that we as a state had a really strong and coordinated response, which is what we're trying to show you today, that we are working together and ready no matter what the situation is. Although, again, our assessment is that the risk is low, but should that change, we have the things in place to really prepare us for whatever we need to do. Now, along those same lines, we do know that testing capacity is something that we have. We know that if people isolate when they're sick, this can prevent transmission to others. We know that there are prototype vaccines that are available that can be mass produced if necessary. Again, I don't think that we're headed in that direction at all. What we want to make clear is that we are prepared as a state. All of the investments into public health that have been done pre-COVID and post-COVID have really been helpful to prepare us should the situation change. My risk assessment is very low, but we want to reassure people that we are ready should anything change.
Okay,
Great, thanks so
Brianna. Any other follow-ups, Brianna? Okay, just go ahead, Brianna, please.
So yeah, sure. I mean, if if there's time and you're here, I'll ask another question.
Yeah.
I guess so. As reporters, like as we continue to follow this, like what are some of the things that we should be on the lookout for as sort of things progress in sort of the cow population?
Mr. Hurlburt, you want to take that first?
Yeah, great question. And as Commissioner Stefani had mentioned, this is an emerging situation. And it was just, last Monday that it was confirmed high path avian influenza in those cow operations in Texas. So we're learning a lot. Part of what we're trying to do here is share out as much information as we can, as we have it from other states and federal partners, to make sure that we are all working off a baseline of information that's as accurate and up to date as possible. So, what we're looking for is, messaging from USDA as to, are there other states that have impacted herds? What is the movement of cattle look like? Are there, so far it's only been limited to dairy operations. Are there concern about other livestock operations or cattle operations? Those things haven't been shared yet. We've got a pretty robust plan across the nation, I'd say, on a state by state and a state and USDA relationship on high path avian influenza response plans. when it's in birds and when it hits commercial flocks and backyard flocks. So, we'll be working together as a unit with USDA, paying attention to this. We get regular updates from our state and national partners. Our state veterinarian is working with her colleagues across the nation. So the goal is that we're getting as much information as possible, distilling it as much as possible, and then getting that good information out to the industry so they can adjust as they need to, should information change or require it.
And just as a follow-up to that, I think as we identify, are there additional states, are there additional places where the cow population is positive, that is going to be keeping us on high radar as to whether additional human cases evolve in the states where we have documented cow positivity. And the concept of One Health is that we have pathogens that can progress and emerge in whether it be livestock, whether it be mammals, whether it be other animal populations, and that trajectory of pathogens that can be in one population that can make their way to the human population is what we are constantly looking at. In terms of emerging infectious diseases, this is usually the pathway where infectious diseases make their way into the human population. So the more we hear potentially, if we get more information, that there are confirmed cases in cows in other states, we are going to be looking very closely to our colleagues in state health departments in those states as to whether there are documented human cases in those states. So that's why you see the two of us here together with both of us for the state of Connecticut, because we don't have any indication of that in the animal population, and then most certainly we don't in the human population. But that's what we're going to be looking to, and what I would encourage reporters to be looking at is what is happening in other states around the country, because that's going to really be dictating whether this is going to be an emerging problem that continues to grow, or whether this was an isolated incident of just one person who happened to be infected.
Great. Thank you, Commissioner Giuttani. Brianna, any other follow-ups?
I think that's it for me for now. Thanks so much for your time.
Great. Thank you. I'd like to open it up to any other questions that our media partners may have. Okay, well, thank you everyone for being on today. We do have this recorded. If someone does need a recording, please email me. Commissioner Hurlburt, Commissioner Giuttani, thank you so much for doing this today.
Thank you so much.
Okay.
Thank you, everybody.
Thank you.
Have a great afternoon.
Okay, bye-bye.